I remember a woman in her late 50s who was passionate about playing tennis. She had suffered a sprained ankle in a game over a year ago and had it treated, but the pain kept persisting. She had visited multiple doctors and therapists to no avail. I asked her if they gave her a diagnosis, and she told me it was sprained ankle. I knew she was very committed because she had driven 2 hours from Connecticut to see me. And I told her on the phone that the treatment would likely require many visits over the course of time. That's if I could figure out what was actually wrong with her. So while taking her history, I went over exactly what had happened when she was playing tennis and she fell. She said she fell to the side and slightly backward, and that her ankle had swollen enormously after just a couple of hours. The doctor had looked at her ankle and took an x-ray, and then she went to physical therapy for several months. She improved, swelling went down, but the nagging pain persisted. Performing the standard assessment tests for the ankle was negative, and there was only very mild swelling. The assessment tests for the peroneus longus were fairly weak, and so I encouraged her to push as hard as she could. And then there was pain during that test. Then I palpated her posterior talofibular ligament right behind the lateral malleolus, for which there's no test because you can't really stress that easily with a test. And when I touched it, it was quite painful. She was happy that I found something, so was I, and that I could help her. So the peroneus muscles are located on the lateral lower leg, and their tendons wrap right behind the lateral ankle together. And this area is often confused with a sprained ankle as the tendons pass right next to two of the lateral ligaments. The other thing that's missed is that the posterior talofibular ligament, which goes from the back of the lateral ankle to the talus, is not very prominent, this ligament. It's kind of hidden behind the lateral ankle bone. However, it is often the cause of lingering ankle pain and mild swelling that becomes chronic. So whenever you see a lateral ankle sprain, always check these two structures because they are often the culprits in chronic ankle pain. Over many years, I have seen clients with ankle pain that goes on and on because the injury was not fully dealt with. You have to get rid of all the adhesive scar tissue and not miss any of the ligaments or tendons that are damaged and involved. When ankle pain doesn't go away, it's usually because something has been missed. In this case, it's a reminder that you always have to dig deeper and never assume it's just a sprain. Inside the Anatomy in Action subscription, we have an entire module on ankle injuries, including demos, assessment tests, and treatment strategies for the structures that we discussed right here. So click the link below if you're interested. Thanks for watching, and I'll see you in the next video.